Medical mistakes, the silent epidemic. Medical mistakes are an issue globally. They're important because one of the top 10 leading causes of death and disability worldwide are attributed to them. High income countries around the world result in 1 in every 10 patients being harmed by care. Low and middle income countries worldwide result in 2.6 million deaths annually due to unsafe healthcare conditions. The World Health Organization has created Patient Safety Day on September 17th and naming this of immediate importance. What is a medical mistake? They are preventable adverse outcomes that result from medical treatment. The highest number of medical mistakes occur in emergency settings, hospital care, and once a patient is returned home after hospitalization. These problems also occur in outpatient care and are not only isolated to hospital care. Medical errors also are not always caught right away by the patient or the provider. They can lead to a health crisis down the line, and sometimes they go completely unreported because they're never caught, or the reason for the health crisis is never identified as a medical error. How do mistakes happen? Lack of communication, medication errors, whether that's by the patient or the provider, and that can be done in an in or outpatient setting. Treatment associated infections, unsafe surgical tools and techniques, diagnostic errors, treatment associated infections, blood clots, sepsis, and lack of interprofessional cooperation. One of the ways they combat issues such as unsafe surgical tools and techniques are making sure that they have an account for all of the items in an operating room. And one of the growing problems that we have is the aging cohort. Between employee shortages in healthcare and insurance companies' unwillingness to pay for extended hospital stays, mistakes are bound to continue occurring.
A study conducted and released on the Johns Hopkins Medicine website in 2016 states that medical errors are the third most common cause of death in the United States. This is merely an estimate since the CDC had failed to classify medical errors as a cause of death on the death certificate. The International Classification of Diseases codes, or the ICD codes, were used in 1949 to tally the cause of death, which still left out medical errors, continuing the inaccuracy of data. This is according to Martin Adel Makary, a professor of surgery at Johns Hopkins. Because cancer and heart disease are labeled as the primary causes of death based on a code that was not precise, the funding and attention that was needed to correct and research the deaths due to medical mistakes was lacking. Providers who were hesitant to report deaths due to medical errors in fear of punishment and/or legal actions were not holding themselves accountable. This led to further damage and even death when a medical mistake was involved.
I'm going to be talking about the critic's view, and there are several reasons for non-disclosure of medical mistakes, one being the fear of being sued, or fear of causing more harm to patient, fear of losing license to practice, and fear of losing good reputation. We can go into that in a little more depth because it's known as defensive medicine, and patients have the right to sue at any point when they are displeased with their care. And about 26% of each dollar spent, which is around $650 billion each year, is what defensive medicine costs in the United States.
Okay, I'm going to be talking about the organization. So the organization responsible for patient safety and working to prevent medical mistakes is the Agency for Healthcare Research and Quality, or the AHRQ. It's also known as the name AHRQ. AHRQ's mission statement, according to their website, is to produce evidence to make healthcare safer, higher quality, more accessible, equitable, and affordable, and to work within the U.S. Department of Health and Human Services and with other partners to make sure that the evidence is understood and used. This mission is achieved through health systems research, practice improvement, and data analytics. The research helps to improve the quality and safety of healthcare delivery. Practice improvement helps supply physicians and other healthcare providers with the means necessary to provide the safest healthcare possible. Gathering and analyzing data helps those who work in the healthcare industry understand what changes need to be made in order to provide safer healthcare to patients. AHRQ was created in 1989 under the name Agency for Healthcare Policy and Research and renamed in 1999 to its current name, AHRQ. The agency works within the U.S. Department of Health and Human Services and was created to provide funding and aid for research that can be used to improve healthcare safety and quality. One way AHRQ has accomplished this is through quality indicators, which can be used to evaluate hospital performance and patient outcomes. Also, their evidence-based research has contributed to the reduction of medical mistakes made by healthcare providers over the years. Approximately 900,000 less mistakes were made between 2014 to 2017, which prevented a little over 20,000 deaths. Today, AHRQ continues to work towards its mission of making healthcare safer.
Hi, my name's Mia, and I will be talking about David Myers for our presentation. First and foremost, he is the board-certified family physician and acting director of Agency for Healthcare Research and Quality. He started pretty recently, which was January 12th, 2021, in that position. He decided he wanted to pursue this field in hopes of ultimately producing sufficient evidence to make healthcare safer, higher quality, more accessible, equitable, and affordable, in his own words. He works with the U.S. Department of Health and Human Services, as well as he also is involved with federal, state, and local partners to ensure that the evidence is understood and used. He leads various strategic planning activities and co-leads the development of Agency for Healthcare Research and Quality's National Nursing Home COVID-19 Action Network, which is a relatively new type of network. He has been elected to the National Academy of Medicine with recognition for his executive leadership of the agency's essential research functions, as well as shaping national thinking through his early and innovative direction of Agency for Healthcare Research and Quality's primary care and practice transformation research portfolios. He has directed the agency's work in support of patient-centered medical home, and he also led Evidence Now, which is Agency for Healthcare Research and Quality's $110 million initiative to help primary care practices improve patients' heart health. Some of his skills are he has 15 years of experience with Agency for Healthcare Research and Quality. He has directed the agency's Center for Primary Care Prevention and Clinical Partnerships. He has also established the agency's Center for Evidence and Practice Improvement. And he also has very experience in community health and family medicine. Some criticisms and negative traits of David Myers. Some initially thought several guidelines from this organization would reduce medical drugs and procedures. Another criticism is minimal years of experience in this position of acting director in the agency. And the recommendations I would suggest is he has a YouTube channel with the Agency for Healthcare Research and Quality, which is very beneficial on its own. However, it is minimally advertised and there is no way for the public to easily find it. I think it should be more advertised on the website for Agency for Healthcare Research and Quality, because it could be a very valuable source to go to. And the videos with him are also relatively short, averaging of about 1 minute and 50 seconds. So I think longer videos would also be beneficial in terms of him. Another recommendation is properly advertising and directing the public to his channel, because it could be a huge benefit as the public can see a face to the organization, and it could be on a more personable level and hear what directly he has to say about these issues. I think putting focus on this YouTube channel and on their website, getting involved in social media can help Myers in connecting with the public more, as well as making the videos a little bit longer. I think all of those factors would be very advantageous. Thank you. And here are our references.